Next tonight, the new £64 million health hub being built in Colchester, which it's claimed will cut hospital waiting lists and avoid cancellations.
Yeah, bosses say beds at the Essex and Suffolk Elective Orthopaedic Centre will be ring-fenced to make sure surgery goes ahead as planned. And Russell Hookey has been to see how the building work's been going.
Hundreds of tradesmen working around the clock on one of the biggest healthcare projects in the East. This is the new Essex and Suffolk Elective Orthopaedic Centre, or ESSIOC.
This is one of our state-of-the-art orthopaedic theatres here at the centre. It's one of 8, and our ambition is to deliver around 10,000 orthopaedic operations a year here at ESSIOC.
They'll include hip, knee, ankle and shoulder procedures. Patients from Colchester and Ipswich hospitals are being promised shorter waiting lists and fewer cancellations.
There's already 100 hub sites up and running across the country. The government spent £1.6 billion funding them. As of March 2025, there will be 130 hub sites up and running, and this the centre here, the Essex and Suffolk Elective Orthopaedic Centre, will be one of the largest.
Well, this is one of 3 ward areas in the new centre. You can see the nursing station taking shape here. There'll be around 300 staff working in the centre. They'll look after 72 beds, although many patients will just come here for day surgery.
At a cost of £64 million, it's been built to relieve pressure at Colchester and Ipswich. But it also has enough capacity to take on 1,500 procedures annually from the West Suffolk Hospital at Bury St Edmunds. Healthcare Suffolk has just begun a consultation exercise to ask West Suffolk patients if they're prepared to travel 35 miles to Colchester.
We want to hear from the community that currently use West Suffolk Hospital or plan to use in the future. Patients, their carers, relatives, their support network. We want to hear about any concerns they have about travelling. There are 2 existing national schemes that support patients to travel to elective hubs and other centres for healthcare. And we don't want to exacerbate existing health inequalities.
The centre will be named after Ipswich orthopaedic surgeon Dame Claire Marks. She died from cancer in 2022 and was the first woman to chair the General Medical Council. NHS bosses say where similar centres of excellence have opened elsewhere in the UK, patients are willing to travel further to have operations sooner. Those using services currently in West Suffolk can make their views known until the end of June. Russell Hookey, ITV News, Colchester.